Here is exactly how the EMT exam works and how to pass it in just a few minutes. To become a nationally certified EMT, you pass the cognitive exam from the National Registry of Emergency Medical Technicians. You take it on a computer at a view test center. Most states also require a separate psychomotor or hands-on skills evaluation, so check what your state asks for. The cognitive exam is a computerized adaptive test. The computer picks your next question based on how you answered the last one. Get it right, and the next one is harder. Get it wrong, and it is easier. The whole time it is narrowing in on your true ability. So there is no fixed length. You will see anywhere from 70 to 120 items, and you get a maximum of 2 hours. Between 60 and 110 of those count toward your score. 10 are pilot questions that do not count at all, and you cannot tell which are which, so treat every question as if it counts. And here is what trips people up. There is no percentage score. You are not chasing 70% or any percent. The exam ends when the computer is confident you are clearly above or clearly below one fixed passing standard. That standard is the same for everyone, no matter how many questions you saw. Which means a short exam is not a bad sign. You can pass at 70 items, and you can fail at 70 items. The length tells you nothing about your result. Do not try to read the tea leaves while you are still testing. Now, the most important thing in this whole video. The National Registry rebuilt the EMT blueprint. A lot of older study guides still teach the old 5 areas: airway, cardiology, trauma, medical, and operations. That is not how the exam is organized anymore. Today, the content is organized around the patient care process in 5 areas. Scene size up and safety, 15 to 19%. Primary assessment, 39 to 43%. Secondary assessment, 5 to 9%. Patient treatment and transport, 20 to 24%. And operations, 10 to 14%. Look at that second number again. Primary assessment is 39 to 43%. That is roughly 4 out of every 10 questions on one thing, walking into a scene and finding what is going to kill this patient first. So the exam is not really testing whether you memorized a list of diseases. It is testing a habit of mind. Is the scene safe? Is the airway open? Is the breathing adequate? Is there major bleeding? Fix the thing that kills first and only then move on. Pediatric care is not a separate section anymore either. It is woven all the way through the exam, so you cannot skip it and hope it does not come up. 3 real questions. First, you find a 58-year-old unresponsive, snoring, breathing 8 times a minute with shallow chest rise and no trauma. What do you do first? Head tilt, chin lift, then start bag valve mask ventilation. Snoring means the tongue is blocking the airway, and 8 shallow breaths a minute is not adequate breathing. Oxygen by mask does not fix a blocked airway or a patient who is not moving enough air. Second, you are checking an unresponsive 4-month-old. Where do you feel for a pulse? The brachial artery on the inside of the upper arm. An infant's neck is short and chubby, so the carotid is hard to find. And take no more than 10 seconds. Third, bright red blood is spurting from a deep forearm laceration. You hold firm direct pressure and it keeps soaking through. Next action, apply a tourniquet above the wound, toward the torso, tighten until the bleeding and the distal pulse stop, and write down the time. Do not keep peeking to see if it slowed. That restarts the bleeding. So how do you prepare? 4 habits. First, study to the new blueprint, not the old one. Put most of your time into primary assessment because that is where 4 in 10 points live. If your review book is organized by airway, cardiology, and trauma chapters, it is not wrong. It is just not weighted the way the exam is. Second, drill scenario questions until the order is automatic. Scene safety, then airway, then breathing, then circulation. Almost every question is really asking, of these 4 reasonable actions, which one comes first. Third, keep a list of every miss and write down why the right answer was right. On an adaptive test, you cannot cram to a percentage, so chase consistency on the hard questions. because those are exactly what the computer will hand you. Fourth, know your retakes before you need them. You get 6 attempts. After 3 failures, you must complete remedial education before the 4th, and you wait 15 days between attempts. That is a real safety net, but it is much easier to pass early. So remember, 70 to 120 items, 2 hours, adaptive, and no percentage score. Exam length means nothing. Primary assessment is nearly half the test, and every scenario is asking one question: what will kill this patient first? Start now with free EMT practice questions at .com/en/EMT free, in English, Chinese, and Spanish with no sign-up.